Hi, my name is Emily Worley, and I am a medical student at KUMC. This summer, I had the opportunity to get to know a wonderful group of Kansans with developmental disabilities and their families. All of them serve on the Kansas University Center on Developmental Disabilities Consumer Advisory Panel, or KUCDD-CAP as we like to call it. The KUCDD started at KU in 1969, and it has been recognized as one of the most important university centers of excellence in developmental disabilities in the nation. The KUCDD-CAP advises the center's directors on projects that the center has taken on, as well as the center's future direction. As a KU medical student and future physician, I asked the KUCDD-CAP for advice on how the medical community can best meet the needs of people with disabilities and what we as healthcare professionals can do to provide quality care to people with developmental disabilities. The following film depicts those conversations I had with KUCDD-CAP members and is focused on topics surrounding supporting those with disabilities in the healthcare setting. I had the pleasure of visiting Ski at his home in Kansas City. Ski provided great advice regarding the importance of medical professionals getting to know him as the patient rather than looking to others present in the room as the primary source of information. Ski makes a simple but invariably important point. It is not only disrespectful to talk solely with family members, support staff, or others who might attend a medical appointment with a person with a disability, but it may inhibit the provider's ability to gather accurate and complete information. While it may require extra time, it is important to our patients with disabilities that they have the opportunity to communicate with those providing them with care. My friend Brad also weighed in on this topic, as well as touched on the importance of ensuring our medical facilities are accessible to all.
Now, but I remember back in the day when I had to have people go with me to the doctor, and I think it's universal because I've noticed even the last couple of days, not in a medical way, but doctors seem to talk to the other individual in the room, other than me, or other than thinking that I don't know what my medical issues are or that I can make those decisions on my own. And so what I've done over the last quite a while now, I don't know when I started it officially, but you know how I resolved that? I go to all my medical appointments on my own so that the doctor doesn't have any choice but to talk to me.
Brad lives in Lawrence, and he is employed at the University of Kansas, where he enjoys his work and coworkers. Although Brad is able to navigate his workplace, home, and community with ease, that has not always been the case when he is in the doctor's office. In my conversation with Brad, he was able to provide some great ideas to make medical facilities accessible and comfortable for people who use wheelchairs.
Okay, so Brad, can you tell us a little bit about the issues you have concerning access, especially in a clinical environment?
One of the first things that I notice when I go to doctor's appointments is the fact that some of the exam rooms are very small. And I've had to work with, actually what I do is I go in and I actually tell the doctors and nurses what I need to make it accessible for me to get in. And sometimes I go in and say, all right, can we take this chair out, or can we move this over, or move the exam table over. The exam table takes up quite a bit of room, and sometimes when you have like the stool for the doctor to sit on, that takes up space, so we end up.
My friend Kathy also lives in Lawrence. While she did agree with Ski and Brad on the importance of medical professionals speaking directly to the patient and not only to their companions during a medical visit, Kathy also explained the importance of family and friends in maintaining a healthy lifestyle and receiving effective medical care.
Kathy, can you tell us a little bit about how your family helps you maintain different wellnesses in your own health?
They try to encourage me to diet. In fact, my mom says, I'm going to ask you how your day went tomorrow. And this was last night. She said she's going to check on me tonight and see how much I've done and what I accomplished.
They're keeping you accountable.
They're keeping me accountable. They're making sure I'm doing what the doctor has asked me to do and to maintain that diet.
Good. And they're pretty big support systems, I take it, as well?
Yes, they are.
Good.
We all need to lose weight.
That's right.
They keep telling me we all need to.
So I know your doctor told you a little bit about that you needed to lose weight and things like that. What are you doing for exercise?
I do a lot of walking. Her goal is for me to walk 1,000 steps a day. Sometimes I walk more than 1,000 steps. The other thing is that everybody would like to see me drink more water and to get away from caffeinated things. And that's really hard after 63 years of having sodas and tea or whatever. I like my caffeine.
For many individuals with disabilities, family members provide invaluable support throughout their lifetime. It is often easy to forget the stress health challenges may place on loved ones, particularly those caring for individuals with disabilities. When I had the opportunity to meet with Stephanie at her home in Overland Park, this fact was made apparent, and I was reminded that the professionalism and care provided by medical professionals extends to more than just the person with a disability. Stephanie is the mother of a young man named Connor, and despite having access to effective healthcare and passionate medical professionals, she discussed the challenges involved in advocating for and coordinating the complex healthcare needs of a loved one with a disability.
Can you just speak a little bit about the challenges you have getting all of those teams together at the same time so that everyone can be on the same page?
Well, in school, he does see a vision person, and he works with the paras and the therapist, and the teacher has 11 kids on her caseload, so, and all of them work with other people, so I usually just copy the teacher on my emails to the therapist or the O&M specials, and I can't contact the parents directly, so I'm relying on the teacher to relay the information about, like, Connor needs different study cards or something, and I feel bad for teachers because they're really bogged down, but there's not a better system in place. And then if Connor, if he gets a new brace from the orthotist, school, they have so much going on, they can't watch him in the lunchroom, and so we've had falls, or he can't, or if he's lost a hand brace before. So it can be frustrating, but I really think they have his best interest. It's just a lot of kids to manage, and then, as I mentioned earlier, he has a rehab doctor at one place, OT and PT at different places, and just coordinating his Botox. It's me relaying with the physical therapist what muscles she thinks needs injected, and the OT what movement she wants. And while I can relay it, I'm not sure if I'm explaining it right or what movement we're trying to get, or if it's an abductor and an adductor, and I forgot by the time I've gotten to that appointment, so I really try to take copious notes. But I feel like Connor's care could be better, and he could, with Botox, maybe a little more functionality if they could all get together and collaborate. But the medical system's not set up for that right now, and they're at different places. However, when we've all had it in one place, it wasn't that collaborative either. So collaboration, I think, would be great. It'd save a lot of money in the long run. As a parent, you kind of want a quick fix, but we realize there isn't one, and it's something that we live with every day, and just be cognizant. If you want us to do something with our child, just realize there's 5 other physicians who want us to do something, and 2 therapists, and he has homework. So I think just kind of keep in mind the whole person, and it's a marathon, not a race. And it's just kind of look at the long lens on how something's going to affect the quality of the person's life.
Thus far, we have visited with Kansans from Lawrence, Kansas City, and Overland Park, all providing great insight into best practices we as healthcare professionals should engage in. For our next few interviews, we were able to meet with individuals outside of Kansas's northeast corner, our goal being to capture unique insights into healthcare within different settings. Jason and Aaron from Garden City, Kansas, discussed perspectives on healthcare from a more rural lens, with Aaron explaining how important it was for providers to understand that he is his own best advocate.
Okay, so we're here with Aaron and Jason today, and I was going to ask you, Aaron, do you have some tips for us as medical students and future
It
providers?
helps me be my best advocate when providers use good and simple to make it so I think it for everyone.
Awesome.
After having the opportunity to engage in conversation with Jason and Aaron, a topic that came up was how important it was to provide information in an understandable, straightforward manner, eliminating some of the misunderstandings that often occur during patient-provider exchanges. As an example, I asked Jason what he thought would be the best way for me to provide information about his blood pressure.
Okay, Jason, so with you, I figured we could play kind of like a role play deal where pretending I'm the physician and you're in the office, and what if I told you something like, we are worried about your hypertension? How would you respond to something like that?
I don't understand.
Okay, so what if I said something more like, oh, your blood pressure's a little high? How does that sound?
Okay.
Using effective communication is an incredibly important skill, and not just for our interactions with those with disabilities. Providing information in a way that can be easily understood and processed by our patients is a cornerstone in effective care. In this example with Jason, I could have even gone further to ensure that he felt confident in the information I was providing by utilizing real-world comparisons and even diagrams. If Jason were my patient, it may have been useful to show him a picture and say something like this. Jason, can you show me where your heart is?
Yeah, sure.
Can you feel it beating?
Yes.
Good. Everyone's heart is beating because it's pumping blood to move throughout the body. See how this picture shows the blood going all throughout our bodies. Think of it like a tire on a bicycle or car. If the tire has too much air and too much air pressure, it might pop. And if it has too little air and too little air pressure, it will go flat. So we take a blood pressure test to see if pressure in your veins is too high or too low. And if it's too high or too low, we want to do something about it, or else you could get really sick. So how'd I do? Did I explain blood pressure better this time?
Yeah, you did good.
Good. So the important takeaway here is that sometimes the first time a healthcare provider attempts to provide information to a patient, it may not be in the best format or contain the most effective terminology. As we demonstrated, we as practitioners must be persistent, patient, and adaptive in order to ensure successful communication and ultimately health outcomes. Right, Jason?
Heck yeah.
Our final interview was particularly impactful as it encompassed a story based out of our very own Kansas University Medical Center. Chris and his mom, Doreen, are from Yates City, Kansas, but spent many hours in our hospital in Kansas City 26 years ago when Chris was diagnosed with cancer. This story ultimately has a happy ending, as Chris is alive and well and currently the chairperson for the KUCDD-CAP. However, several lessons were gained from his experience being treated at KUMC. Here is Chris's story.
I wound up in the ICU for a good while with a pneumonia in my right lung, and my left lung was deflated with a drainage tube in the side. When the time came, the medical student came in to remove it. Well, his supervisor was not their supervisor, and he did it. If I would have known what verbal abuse was, I would have reported to his supervising physician. Yeah, he started saying all sorts of,
calling him a sissy and a baby,
Yeah.
because he was going to take the tube out. And, you know, Chris had been through so much. And,
my dad literally had to leave the room.
yeah, my husband had to leave the room. But he just jerked it, and when he did, he threw blood and tissue all over. But anyway, that was just one of the negative things. But my thing, KU is a learning hospital, and we had different doc students. It's like you know, you're going to come in, you want to learn. You want to know all about Chris's. One student was so observant. Chris has the broad thumbs.
Yeah.
He did the research. He found out what kind of syndrome Chris has. He has scoliosis. He has learning disabilities. You know, you get tired of telling your story over and over, but that's how you're going to learn. And that's how they learn. And, you know, we did our chemo for a year and a half. We were back every month. We were just like one big family. All the families that were there with her. Chris, to my knowledge, is the only one that survived.
Yeah.
Which, by the grace of God, that always took care of us and still does. But it's a wonderful place.
After traveling across Kansas and interacting with some of the most passionate individuals I have had the opportunity to meet, I would like to wrap up with some of the lessons our Kansans with developmental disabilities and their family members shared. First, it is essential for healthcare professionals to be good listeners. This means, first and foremost, identifying the patient as the primary source of information and providing adequate time to ensure this is a possibility. It is extremely important that our providers talk directly to their patients and not solely to those brought as companions to the medical appointment. As with any other patient, those with disabilities have a unique insight in regard to what is going on inside of their own bodies. Second, in order to ensure effective communication, information must be provided in a way that is both accessible and easily understood to the patient. It is often difficult to suppress our use of medical jargon. However, it is essential that we engage in user-friendly language. For some, this may mean providing an overall picture rather than inundating our patients with details that are often overwhelming and not easily understood. For others, it may mean being adaptive in the way we are presenting information. Either way, we must remain patient and persistent in order to ensure our patients leave feeling confident in their own knowledge and care. Our third lesson focused on accessibility, highlighting the importance of facility layout and attitude. It is important to ensure that our exam rooms and other facilities not only comply with legal standards, but are designed with our patients' comfort in mind. Particularly for those with developmental disabilities, we should not hesitate to ask if there is anything that can be done to make the visit more comfortable. Finally, this experience exhibited the importance of family members and other companions in the lives of our patients. These individuals often represent the most enduring and considerate forms of support those with disabilities have. Because of this, it is important to address caregiver burnout and stress and understand the unique struggles they face on a day-to-day basis, ultimately ensuring those with developmental disabilities have the best possible support system in their corner. I appreciate you taking the time to meet some of our community members and hope you will put these invaluable lessons to practice so that we can begin to ensure all populations are receiving quality, comprehensive care here at KUMC. Thank you.